us in Eureka. We're going to talk to a visitor to Eureka.
What do we want?
Why are you here today? Tell us what brought you.
Hi, Ryan. My name's Noni Mingo, and I'm actually from Reading area.
Okay.
I came here to Eureka to help support and unite with the union workers here, and because they deserve better pay, livable pay, and the same kind of things are going on in Reading at the Windsor Reading Care Center. So I am a nurse from there, and same kind of thing. We have short-staffed. The quality of care in that place is, it could be a lot better.
What's the average wage of somebody employed as a caregiver at Granada or a similar facility like yours in Reading?
Well, it's interesting what I've learned today, because I've been here for the day. Eureka and the wages with the Granada up against Reading area are significantly lower than our pay scale there.
Okay.
All across the board, the CNAs, LVNs, RNs. It is significantly lower than Reading. And so these people need an increase.
Yeah.
I mean, they need to be at least, I'm well aware of the, depending on where you live, the economics of living are different for different areas, but, we're healthcare workers. CNAs, they work a lot harder than, say, a fast food employee.
Okay.
And yet they're practically paid the same. And that shouldn't happen. That is why we're here.
Yeah, that seems incongruent with the level of work and expertise needed to do the job. So
all that's required for a fast food person is a high school diploma. Quite a difference,
Yeah.
It's very involved. For a CNA to keep that certification yearly, what they have to go through for their continuing education units, and it's even harder for a CNA to keep their CEUs than a nurse. So I feel for these people here, and I support them just as if I would be supporting my own people in Windsor. I've been a full-time employee with Windsor since October 2020. I've worked COVID units, all shifts.
Yeah.
I've worked whenever my DON wanted to, ask me to work. And they have, last year they didn't work me for 3 months, and I'm a full-time employee. So there's many violations of our contract that have occurred.
Okay.
And so we're trying to, this is what we deal with. We have several people here from Windsor, the CNAs. They're here to support
What's the California Nurses Association?
SEIU.
SEIU
2015.
Okay.
Yeah.
So we spoke earlier, and we were looking at the billboard over there on the sidewalk indicating that there are bonuses for new hires. And you indicated that may not be the case. Can you tell me more about your experience with the bonus?
Yes. What's indicated on there, posted in the front of their facility here, is what our facility did in October through December last year of 2021.
Right.
They had bonuses on top of the regular pay to be an incentive.
Yeah.
Because they were afraid that people were going to quit. Those that were, the state of California mandated people had to be vaccinated.
Right.
So Rockport anticipated that there would be people that quit, because there actually were people quitting. And they gave the incentive that a pretty significant bonus on top of the regular pay for 3 months. And they even stated that it may even last longer, but it didn't. And so this facility, I noticed myself that they are showing that incentive pay as well.
It's currently advertised.
Right. Yeah. And yet I'm hearing that it's no longer in existence.
Right.
So
Okay.
I will be calling their phone number and finding out if
Sure.
It is true that they're giving the bonus.
I was thinking of doing the same thing. There's a phone number there. Anybody's welcome to call it. I can't wait to hear what it says.
Yeah. But I'm here because my facility's not working me. I am still employed there technically, but they choose not to work me, even though they're short-staffed. My nurse friends there, they constantly are letting me know, why don't you come back to work? And I've tried to negotiate things with the Windsor and Reading, and it's just, it's not, it hasn't prevailed yet. I also have gotten my union involved, the SEIU 2015, and there are several grievances. I mean, because the facility doesn't choose to negotiate civilly with each staff person, we go to them and we try to civilly work out something staff-wise, pay-wise. But it's kind of like the company, the Rockport company, pushes us to use our union and to get our organizers and people involved. And we have to write grievances that shoot to their attorneys and their people, and that's what we're in the midst of. And I'm right in the middle of it too. And I am anticipating highly that probably this month, towards the end of this month, April, they will terminate me as well.
Wow.
So, I mean, it's just, they've already kind of given me clues in the past. They're not allowing me to get my family leave sick time pay. They're not allowing me to work. Also, another reason I'm here is because, unfortunately, in our contract with SEIU 15 in Reading, it doesn't allow us to voice and to picket in front of our facility. So that is also why I'm here.
Really? Yep. Not even on a public sidewalk?
Nope.
That's interesting.
And they put it that way in the contract. So we're hoping that when the contract renewal comes up this year, hopefully the employees will want to change that clause.
Right.
So.
Okay, thank you for speaking with me. I really appreciate your time and all that insight. Is there anything you want to add?
I just hope that Rockport will come through and see the significance and the importance of their employees, because they really don't. We don't feel it. I mean, they can give all the pizza in the world to all the shifts, is what they do. But, and yes, it's good that you pay your people what they're worth.
Right.
We'd like to see a Rockport that actually makes the staff feel appreciated and worth, why we're there. We're there for these residents and to take care of them and their families. And that's the priority. That is what the most important thing is. You got to keep your healthcare workers, not keep them quitting.
Yeah.
So,
okay,
thank you very much.
Thank you.